This doesn't only apply to our patient base, right, which tends to be older patients. It applies to any person who's had an acute experience, whether that's injury or illness. You know, following the clinical orders, following the evidence-based protocol for what you ought to be doing to get well is just smart. And to your point, yes, it's good in terms of the overall population health, but more importantly, on an individual patient basis, everything that you do to comply with those as closely as you can to the letter of those orders, the more likely you are to have a good clinical outcome, a good experience as a patient, as good an experience as you can have if you've endured an illness. And you know, another point to be made in this is you know, for these patients that discharge home, is make sure that you ask for medications reconciliation. We do it as a matter of practice. You know, we in many instances have a Form D that reviews a patient's medications list. What we're looking for is duplicative medications, making sure that the patient understands dosing instructions, making sure that he or she understands, you know, time of day that he or she ought to be taking their meds. And for some of our patients that are in certain risk pools, we have a call center where if they get home and they're confused about what they ought to be doing or their meds, they can call the call center. It's paramedic staffed. They operate under the direction of a physician. That paramedic has access to the patient's medical records, so they, you know, call, hey, I'm confused about this med and that med, when do I take them? That paramedic can pull up their medical records and can immediately triage what that patient needs by telephone.